explain to us, for some of us who don't know what epilepsy is, people who don't know what epilepsy is, what is epilepsy?
Besides a tongue twister, it is a neurologic condition, basically, that causes a person to have seizures over and over again. And it's important to note that when we talk about seizure activity in and of itself originates in the person's brain, which a lot of people don't know. Most of the time when you hear the word seizure, you think of the physical symptoms, shaking or convulsions or a loss of consciousness. But it's important to note that the seizures themselves are happening in the person's brain. So it's an overload or a power surge of electrical activity. And when this overload or this power surge occurs, that's what then produces these possible physical symptoms that the person may see. So the area of the brain impacted by the power surge, by the seizure, will determine the symptoms the person experiences.
So could you explain, I guess, so let's say my child is in school and they experience their first epilepsy seizure, or maybe I didn't know my child had epilepsy, or they just experienced a seizure. What are some of the first steps I should take as a parent?
So when it comes to a first seizure episode, I think it's really important to first and foremost, well, depending on what type of seizure they had. So if it's a convulsive seizure, a tonic-clonic seizure, where they've lost consciousness, they're shaking all over, that is definitely an immediate trip to the ER. Okay, so if any child ever has a convulsive seizure, always important to get to the ER to see what happened. Because I will tell you, first-time seizures sometimes are symptomatic. So 1 out of every 10 people will have a single, usually convulsive seizure episode at some point in their lifetime. And so if that happens, the doctors need to figure out what caused that seizure to occur, because most of those seizures are what we call symptomatic. So it was caused by a fever or a head trauma or some sort of infection or another neurologic issue like a stroke or a tumor. So important to get that checked out for a first-time seizure episode. But that's for convulsive seizures. Now we have some students that we work with that have what we call non-convulsive seizure episodes. So they're seizures that are not what we would think of as your typical everyday seizure. It could be a staring spell. It could be a muscle spasm. It could be a sudden fall. Or sometimes a symptom where this child, looks awake, but they're not really aware of their surroundings. They're not responding, and they're performing some sort of repetitive task. So they might be picking at their clothing or touching their face or smacking their lips repetitively or just staring into space and completely glazed over and unresponsive. And so these are non-convulsive episodes. And a lot of times when we have parents going to seek out first treatment for an episode like this, it's usually because school staff has reported to them that they're noticing this odd behavior at school, that something's happening with the child. They're not quite sure what it is, but they've seen it more than once. It doesn't feel right. You might want to take them to the doctor to get them checked out. And so in a non-convulsive episode where you may suspect something's happening, and you just want to see what that something is, you can go to your primary care physician. So you can go to your pediatrician, your internist, your family practice doctor, and just, describe what's happening and see what they say. They may make a referral, or you can just jump straight ahead to a doctor who's a pediatric neurologist. So these are doctors who specialize on the brain and specialize in children's brains. And so they may run you through a gamut of tests. You can even skip the pediatric neurologist and go straight to a specialty doctor called a pediatric epileptologist. So these are neurologists that specialize specifically in epilepsy. So it just depends on what's happening, how severe it is. Most doctors, they'll hit the pediatric neurologist first and figure out what's going on. And in a case like that, the doctor will usually do a medical history. So they're going to do a full workup. They're going to ask you lots of questions about what happened. It's helpful, if school gave you kind of a description of symptoms, to bring that with, because the doctor will say, some questions could be, could the episode have been provoked by something? Before it happened, did they not get a good night's sleep? Were they using alcohol or other drugs before it happened? Or was something else a factor? Were they sick? Did they have a fever? They'll ask if there was a warning sign. Did they get dizzy, or did they kind of glaze over before it happened? Or did they, say they had some sort of weird pain or see something funny? They'll ask how long the episode lasted. They'll ask what happened after the episode. So when they came back to, or they regained awareness or consciousness, were they out of it? Were they tired? Were they disoriented and confused after the fact? So the doctor is going to, ask a lot of questions about the incident itself. And then they'll probably do a thorough examination. He'll probably order some tests. He'll do a blood test. He might do a CT or an MRI. And then they might do what's called an EEG.
Okay.
And an EEG is a specialty test, kind of used to diagnose seizures and epilepsy. And it stands for electroencephalogram. It's a very...
That sounds scary.
I prefer to use EEG as opposed
yes, I
to
like
the real
EEG
word.
better.
So basically it's a brainwave test.
Okay.
So they're going to attach electrodes to the child's head, and the doctor's going to maybe try to trigger a seizure episode. So they might throw some stimuli at them, flash lights in their face, have them hyperventilate. In some cases, they'll have you bring them in, maybe deprived of sleep ahead of time.
Okay.
And they're going to look for changes in the brain's electrical patterns. So they're going to look for what they call spikes and waves, and that would indicate seizure activity in the absence of physical symptoms. And so after that, you know, the gamut of tests is run. The doctors may have a conclusive diagnosis that they'll make, or some of the tests may come back normal. And so it doesn't necessarily mean they're not having seizures. It just means that if they have seizures, they didn't have one while they were hooked up to the EEG.
So this could be an ongoing process.
It could be an ongoing process. So normally what I tell parents is if they've gone for an EEG and they've done the whole gamut of tests, and the doctors, you know, and maybe they're just seeing their pediatrician or they're just seeing a general neurologist, but the weird behavior is still happening. They're still noticing it. They're cued into it now and they see it happening. That I always recommend, or I ask, how long was the initial EEG? If they tell me 20 minutes, I normally say that probably wasn't long enough, and they might need to go in for a longer period of time. And so that's when it might help to go to an epilepsy center to see an epileptologist. And here in Chicago, we're really lucky. We have access to many experts in the field of epilepsy. And so if they make it to any of the major children's medical centers, UIC, Comer, Lurie, that they will have access to an epileptologist at any of those centers.